Welcome, dear Ulrike. I'm really glad you're here to share your visions, your point of view, as we mentioned, together with Bart van Weyenbergen, who unfortunately is not here, but he joined us a few days ago to talk about what happened in the pharmaceutical industry. A lot of things happened, that's for sure. So, Ulrike, I suggest first of all to have a look at what Bart has to say about the impact of COVID on the healthcare sector. Let's have a look.
Thank you, and that's a great question. So during COVID, what we first observed was a huge impact on our demand. 2 times more antibiotics, 3 times more intensive care products, but we were able to follow that huge demand because we had no issues with our main building blocks. For those we have a dual supply chain, and I think most companies has that for their key products. A big surprise to me, however, was the availability of consumables. And then I think about filters, tubings, gloves, and so on. And to give you an example, on the sterile filters, we had a lead time of from 1 month moved to 6 months, which was a big surprise to us. The same happened with our folding boxes. The folding box lead time went from 1 week to 12 weeks, and that was the surprise. And that required a lot of micromanagement for us. Next to that, the pharmaceutical business did a great job to bring in no time a vaccine to the market. We did it 10 times faster than we normally do. And just to give you an example what it means from a manufacturing footprint, every 2 weeks we had to double our manufacturing footprint. It was incredible and amazing job done by the healthcare industry. Now, instrumental to that was also to have the 2D standards, because the 2D standards were crucial to give traceability to the products. And traceability is very important because you need to know that today the vaccines are one of the most counterfeited products in the world. And without that traceability, we could not give trust to the markets and to the patients that they have the right products in their hands. So that's another learning out of the COVID.
Wow, Ulrike, a lot of learnings, but also here a huge demand, the need for traceability. So could you share with us your insights about the healthcare sector and of course how GS1 really can support or help, let's say?
Yeah, definitely it was a time where we had to learn a lot and where we have learned a lot and will still learn a lot in the future, as already mentioned. So it's now 18 months that WHO has declared that we have a global pandemic due to the COVID-19, and we needed to act on this across the world. We had an incredible amount of suffering, really. We had over 235 million infections across the world, and we are coming nearly now to the limit of 5 million deaths. So really, across the world, we were all affected by this. On the other side, as Bart just said, we have seen incredible innovation also. So we have seen vaccines developed in record speed time, safe vaccines, which now have been administered to people across the world. We have now today nearly over 6.1 billion vaccines administered, and not an easy task, specifically also in the supply chain, because we talk about vaccines in a specific cold chain, supply chain. So really, I think a big achievement, but let's be very clear, we are not at the end, and the pandemic will continue, and we will still need to live with that for quite a while, I think. So our world has changed very much, and I think healthcare is so much in the center of the attention of everybody now. If you meet your family, your neighbors, and you ask, how are you? You really mean, how are you? How are you dealing with this? Have you been ill? Are you fine? So healthcare has never been more important to all of us than in this time, really. And of course, we have heard the huge impact on manufacturers, but there was a really huge impact on hospitals and caregivers across the world. Our health systems were really challenged. We were really going to the borders. And we still today have countries where the systems are just overloaded and can't treat all patients. We have just gotten this call from Romania, who are just not able to have to treat enough patients. That's the case in many other countries in the world, really, and patients really suffering from that. So a really very serious situation for all of us. But we have also recognized and we have learned, and that's the good thing, that we talk here about a really global problem. A global problem which also needs really global collaboration, interoperability, and needs global standards, because we need to talk with one language. And GS1 is really the business language and is needed if we want to have systems to talk in one way with each other. So, as mentioned already before, in the retail sector, we have seen a move to digital. We have seen also absolutely a digital transition in the healthcare sector. And you can see in this picture here the digital thread and how GS1 standards enables this move to digital, how everybody in the supply chain can use our standards, really from the manufacturer down to the hospital, but also regulatory bodies and insurances are affected by that. And I think that is really important. GS1 standards are enabling this collaboration between all the stakeholders in the supply chain. And I can encourage only everybody, there will be a follow-up event on the 14th of October where Thomas de Reet from the University Hospital in Leuven and Dirk van Wouwer from J&J will talk about how they are using the standards, how they have implemented their experiences, and also specifically with regards to the COVID time they have experienced. So I think I encourage really everybody to listen to these two champions in a good week from now. There was a very important paper published by Deloitte looking at the global COVID-19 supply chain. And it's talking about something which is really important. It's talking about trust. And Deloitte pointed out that what you need to secure trust is really that industry needs to collaborate with each other. And I think we have seen this in this time of the global pandemic in a really unique way. Everybody has worked together to make change happen, to secure patient safety. And we see also, of course, that there are certain aspects, Bart already talked about the fake vaccines and the counterfeiting, which we have also in this time. So we need to have really an efficient but also secure supply chain. And Deloitte has very clearly stated that global GS1 standards are so important for that. So I encourage everybody really to read this white paper and to have a look at that. In this white paper, Seth Berkley, the CEO of Gavi, which I think today everybody knows, is really talking about that we need to track every vaccine, that we need to have the 2D data metrics barcodes on the vaccine to really enable visibility. And also at the beginning, where everybody was just wanting a vaccine and manufacturing lines had to be changed, not every vaccine box had already a barcode on it. I must say we see this now more and more, and I'm sure this will be something which will really enable visibility in the supply chain for vaccines and beyond, as we have it today already for many other products in the supply chain. Criminals are unfortunately leaping on this, and they have tried to make really money from this. We have seen counterfeited, substandard masks. I was very impressed when the head of the Nigerian regulatory body told me that out of the 8 products for hand sanitizers on the market, 6 were falsified, so an incredible amount. We have seen the first falsified vaccines on the market before we had the first regulatory authority approving vaccines. So it's incredible how inventive criminals are, and that's a lot of concern here of Interpol, but also of regulatory bodies across the world. And that's why we really need standards. And that is the reason why UNICEF, Gavi, with the support of World Bank, WHO, and other important organizations, are building a database, a global trust repository. So a database which will be enable traceability authentication like we have it today in Europe for all the prescribed drugs already, which will be enabling that only safe and secure vaccines are coming to the patient. And this trust repository will be built totally on GS1 standards with our global trade item number, with the G10 and the serial number, but also with our sharing standards, so the EPCIS standards. So it's really based on GS1 global standards, and it's well underway now, and I'm really looking forward to that because it will make patients safer everywhere. WHO is also very concerned about the safety of products and safety of patients across the world, and that's why in March of this year they published a policy paper on traceability, which is really guidance for all the member states across the world. And I think it's really encouraging that for the first time they have really stated that GS1 standards are really the standards which must be used for pharmaceutical traceability. And you see here the data metrics, the barcode, which you can find here also in Belgium on all prescribed products already, with the G10, the lot number, expiry date, and the serial number. That's really the WHO recommendation for everybody across the world. And in August of this year, also the ICMRA, which is a group of regulatory authorities for more than 30 countries, WHO also involved, have developed a recommendation on the common technical denominator for traceability systems. So what should traceability systems themselves base themselves off? And they say, as you can read here, GS1 standards are the most widely accepted and adopted international data standards for pharmaceutical identification, coding, and data exchange. So to just summarize some of the key points here, we have seen in this global pandemic that we all need to work together. We need cooperation, we need interoperability, and that is really very important. GS1 is in the moment also chairing the JIC, which is a group of standard organizations which are really working together to make interoperability happen for the benefit of patients, to make interoperability happen so that system can accommodate standards across really the world easier. Then, as I said, trust is really important. We need a trusted supply chain. We all want to be really safe when we receive our vaccines, and we want to have really safe medicines. It's not only vaccines, also other drugs and medical devices are needed. And for the safety of that, we see in Europe the medical device regulation now coming out, where also GS1 is one of the issuing agency, and we are working with our stakeholders in the medical device industry. So we will see our barcodes in the future on gloves, on masks, on many, many products which are used in hospital and in the whole healthcare sector. And we have learned that our supply chains are really global. It was really a practical exercise because we needed to ship products from the place where they were available to the place where they so urgently were needed and are needed. And that is something which was, I think, for the first time so publicly visible, that we need to have standards which work across borders and not something which really works just in one country. Our standards, the GS1 standards, are really a very important enabler for that and are playing a key role now and also in the future to improve healthcare processes in the supply chain, but also in the clinical processes to really ensure patient safety. And I think, as I heard a little bit just in the retail sector, it is a challenge for all of us, but I think we have also seen a push into a digital world. We have seen innovations, corporations working all together to keep us really all safe. And I encourage you, if you don't know enough yet about GS1 standards, attend the GS1 Belgium event on the 14th of October. We, on a global level, have also an online summit which will take place in November, really on a global level, talking about what is going on everywhere in the pharmaceutical healthcare industry, in the medical device industry, with hospital, with regulatory bodies. And I encourage you to register there. And let's not forget, safer, more efficient care. Starts with a simple scan. The beep is so important also in the healthcare sector and for all of us, because we can be patients tomorrow. Thank you so much.
No, thank you, dear Ulrike. So let's embrace the beep. It's clear that its traceability is so important for trust, for our health, and of course to be safe. So thank you very much. I think that for people who are watching and who are really active in the healthcare, so the next session next week is really not to miss. Put it already in your agenda. Ulrike, I suggest to go once back to Bart, because I asked him a question and I said, how do you see the future of GS1 standards in the future? What are the lessons learned, but especially how are they impacting the healthcare value chain? So let's have a look what he said.
Yeah, for sure there is impact on the healthcare supply chain coming out of the COVID crisis. So one of the things we see, and it's very visible today, is that the government wants to have more oversight of the supply chains. And basically there is a whole trend to do localization and to have in every country a manufacturing footprint or an inventory of products that they can rely upon. Now that's not necessarily a good thing for the industry, because in the industry we have a global setup, and that global setup served us very well to bring in some agility and to serve the right products to the right patients at the right moment. And another element that is very important is global traceability. Till now, there was a lot of focus in the developed countries on traceability and serialization, but it was not the case in the non-developed countries. And today what we see in the COVID countries, like the African countries, they also want to have traceability. Now, otherwise it will become unmanageable for the industry to have a standard and a matrix and a traceability matrix for each individual country. So there GS1 can play a key role in bringing that global standards to all countries in the world.
Wow, thank you very much, Bart, and thank you, of course, Ulrike, for joining us here in the studio. I think you made it really clear, showing how the GS1 standard has been helping the healthcare sector the past months and will be helping them in the future, so thank you very much. And now, ladies and gentlemen, it's really time to turn the lessons learned into real actions and improvements, especially with the boom in e-commerce. We are thinking about more online selling and, of course, also selling through via the marketplaces, and that's the reason why we also invited our next speaker as a category leader personal care and medical appliance of Amazon Europe. I'm talking about Stijn de Meerseman.